As you look at Anthem or other insurers, how has COVID changed the way they may be thinking about their processes or different strategies or objectives going forward?
It changed the way payers, insurance companies work dramatically, and I think a lot of those changes will be permanent. So I've learned, and just recognizing I've been here for a short time, but what Anthem did in the course of 2020 to respond to the pandemic, I think was nothing short of heroic. So, there was a call, sort of an immediate call to action to change processes that perhaps could be characterized as bureaucratic, right? To be much more focused, to be faster, to speed up support of the community of providers, to sort of remove some of the barriers that had existed in the payer world, even at Anthem, prior to the pandemic. So, telehealth is a great example of that. To move quickly and say we should scale this up, we should support it, we should support it on par with the in-person encounter. That whole series of decisions was really important, both on the public sector side and what private payers did. So that's number one, right? Like there was just a call to action that I think an organization like this needed to respond to, and I think the decreasing of bureaucracy needs to stick with us. Being able to be a good and efficient and facile partner that can pivot on a dime needs to stick with us. Um, a second thing in terms of member support, so I've learned, looking back at the experience, this organization, like so many others, and I do want to credit the ecosystem for doing this, really stepped up to try to understand what patients, members needed in the moment, right? So this organization literally made hundreds of thousands of phone calls to our members in order to find out if they needed food, if they were safe at home, if they needed medical attention, to get them that medical attention because there was so much concern about going into a hospital or office. And then turned around not only to assess those risks, but actually to meet them, to meet our members where they needed to be met, right? Did literally tens of thousands of food deliveries into the home, set up the telehealth encounters. That level of engagement with our members, I think, felt probably very different. It felt really right, I know, for the teams that worked on it here. And I don't, that is an ethos and a spirit that I don't want to lose going forward. I mean, we need to be as connected to our members' lives post-pandemic as we did, out of a sense of kind of urgency and just doing the right thing in the moment of the pandemic. So absolutely, I think the payer landscape is going to change in fundamental ways and stay changed, and I imagine the same is going to hold true on the provider side.